The Indian Council of Medical Research has issued a new advisory for COVID testing, detailing who should get tested after coming in contact with a COVID patient. The ICMR has said that if you're not a high-risk contact based on your age or comorbidities, you do not need to get tested after exposure to a COVID patient. People undertaking interstate domestic travel also don't need to take their COVID tests after being exposed to a patient. Testing has also been advised, or rather has been not advised for asymptomatic individuals. However, the ICMR has advised testing if you are an at-risk contact aged above 60 or are comorbid and have come in contact with a COVID patient. Symptomatic people are required to undergo testing after exposure. But what is the strategy behind these revised rules? What are its pros and cons? We will discuss all of this with our experts on the show. But with these slew of changes and a variety of COVID tests available in the market, if you're confused when, where, and how you should get tested, please do give us a call. Our numbers are flashing there, and we'll try and answer those questions with our experts. Dr. Sanjeev Bagai, chairman of the Nephron Clinics, Dr. Yatin Mehta, chairman of Medanta Institute of Critical Care, are joining us this evening to answer those questions. We have Dr. Bagai with us. We'll just wait for Dr. Yatin to join us in a bit. But Dr. Sanjeev Bagai with us this evening as well. Dr. Bagai, good evening. Thank you so much for speaking to Mirror Now. I appreciate you joining us. Sorry, do we have the line with Dr. Bagai just to check? Okay, we'll try and get in touch with Dr. Bagai in just a bit, but Dr. Yatin Mehta joining us. Dr. Mehta, good evening. Thanks so much, and sorry for that little mix-up over there. There are no rules to COVID. We're learning as we go along. There's no handbook that we can rely on. So obviously, you know, the rules of testing, of isolation keep evolving as it's a dynamic illness. Just break down for our viewers what the new testing rules are, because with all these changes, I'm sure there's a lot of confusion doing the rounds.
I think, Aarti, the new rules are actually quite straightforward. Basically, if you are symptomatic in the present times means that you've got a cough, cold, fever, body ache, then you should be treated with a suspicion and you should be tested with any of the modalities which we have for testing for COVID. If you are exposed to a patient who is confirmed COVID positive, then if you are at high risk of developing COVID or getting a severe COVID, if you get COVID, like if you're age of more than 65, if you're a diabetic, if you're immunocompromised, if you are a cancer patient, if you're a heart patient, if you have a bad lung disease, and so on, then you need to be tested. But if you don't fall into any of these category and you are asymptomatic, that means you have no symptoms, then there is no need for testing. Just observe yourself for the next 3-4 days, 5 days. If you develop any symptoms during this period, then of course you fall into the category of symptomatic people and you need to be confirmed for the testing. So it is very clear, if you are symptomatic with any of these symptoms, or if you are come in close contact with somebody who's COVID confirmed case and you fall into this category of high risk patient, then you need to be tested. If you are in low risk category, then you don't need to be tested.
Okay, Dr. Mehta, just, for further clarity, to drill this down further, when we say high-risk contact, whom do we mean?
That means the person is at high risk of getting a COVID, or if he gets a COVID, to get a severe COVID. That means elderly people with immunocompromised status, like who's on steroids, who have asthma, who have bad lung disease, who have other comorbidities like bad heart disease, who's very fat, and so on. These are the risk categories. Then they are at a high risk of developing the disease. Not only that, if they develop the COVID-19 disease, then they are likely to get a severe disease. So these are only the patients who need to be tested. Everybody who comes in contact need not be tested. That is what it is saying, because now the time is over where we tested everybody who came in contact. Neither we have the luxury, and now it has spread so much that there is no point of contact tracing.
Dr. Bagai also joining us this evening. Dr. Bagai, what do you make of these new rules? Is it an important change, one that has been necessitated by the evolving realities of COVID now, or perhaps too early to make this change, given we're now looking at a new variant?
Yeah, good evening. Am I audible?
Yes, sir. Yes, you are.
Yeah, so I think we got to modulate our strategy going forward because the variant has actually now become so transmissible. It is 6 to 8 times more transmissible and almost 70 times replicating more than the Delta in the upper respiratory tract. So, as my previous panelist beautifully explained, it is almost impossible to do the primary contact tracing and the secondary contact tracing once it's so deep spread into the community. So the four basic categories which are classified as high risk for me would be the elderlies above 60, 65, people with comorbidities, be it chronic lung disease, chronic kidney disease, patients on hemodialysis, patients on steroids or any immunosuppressant therapy, obesity, hypertension, diabetes, and so on. Pediatric population also has a significant amount of comorbidities, and we know that Omicron is affecting children 6 times more than what the Delta did. Apart from that, the patients who have just recovered from post-op and other kind of procedures. So broadly, that is fine, but keep in mind that almost 35 to 38% of adult population is asymptomatic and 49% of children are asymptomatic or symptomatic. So you really don't know whether you're carrying or harboring the infection. So if there is any suspicion of doubt, that is the key point which I need to clarify and stress on. If there is any suspicion of doubt, if you're having any kind of viral-like illness, please get it tested. Over a period of time, there would be a question of balance between the supply and demand because almost everyone would tend to do it. And the last important point I want to make is in random screening, when you're looking at random screening at a large scale, the rapid antigen test, which has now been modified as a quantum or a lateral flow rapid antigen test, gives you a near 95% sensitivity and specificity. So we should rely on the rapid antigen test. It is cheaper, quicker in 30-minute test, and it picks up the infectious load about a day earlier than RT-PCR. When you're at the infection, when your viral load is the most. So a rapid antigen test, judicious use mixed with RT-PCR in a combination, depending upon which segment cohort you're screening or diagnosing, would be an important way forward.
Dr. Bagay, it's interesting that you mentioned the rapid antigen test because it was something I also did want to discuss with both you and Dr. Yatin Mehta, who's our fellow panelist this evening. We're noticing a trend, and this is something that the Karnataka government and even in Mumbai, they have red flagged, where a lot of home kits are available. Now, it's a great tool, especially when since there are so many symptoms doing the rounds along with the common cold and the flu. But a lot of people who are testing positive are not necessarily reporting that back to the authorities. And that's a huge loophole, wouldn't you say?
Yeah, so what is really important is a failure of implementation of policy should not be depicted as a failure of the test. The test is a magnificent test. Worldwide, it has shown great results, especially in this, the Omicron era. And what we really need to do is we need to flag where the tests are being bought from. So over-the-counter cash payment and things should be stopped. Home delivery should be stopped for these tests. We need to track the test and the reports. I think we need a very, very strong message given to community at large that if you are doing a home test or if you're doing a rapid antigen test, if it is positive, please report to the local authorities. So there should be a hunting number in almost every city, every tier 2, tier 3 town in which people track. The important thing is to pick up a case which is positive in the early phase. The longer you delay the isolation part, the greater the spread of the virus. So to give you a very quick last one line, this is supposed to be as infectious as measles. Measles carries an R0 factor of between 8 to 11, 8 to 12. This transmits more than measles. It can remain suspended in the air for more than 9 hours. It can travel from room to room more than 60 feet. The catch here is to pick up a case early and isolate early so that the spread and the transmission is stopped at the early phase. Over to you.
Well, Dr. Bagay, on a lighter note, here at Mirror there are no interruptions. You can take your time and speak because it's a very important conversation that we also need to have. I'm sure people have a lot of doubts and questions regarding this matter. So no rush at all. You can explain it as detailed as you would like. Dr. Mehta, let me take this question to you about rapid antigen tests. It's been a very, very crucial tool in the fight against COVID. But as I was saying, there is that risk that people are not really reporting back in terms of if they are positive. And there is also perhaps a possibility that there are no really drawbacks of everyone constantly testing often, is there?
No, see, through your, again, channel, I would like to say, and Dr. Bagai has already emphasized that if you are test positive with the rapid antigen home kit and you are not informing the authorities, common laypersons will not know what to do. That means they will expose all their family and the neighbors to the disease, and it will spread. I'm seeing it every day. One family member gets it, they don't know what to do. They do not understand what do they mean by isolation and what sort of isolation it should be. So they hide the fact, and then it spreads to everybody. So I think it is in your own interest, obviously in community interest, that you must report it to the authorities. So you are advised correctly of what to do. Anyway, if you are rapid antigen test positive, the ICMR guidelines say that you are positive. You do not need to reconfirm with the RT-PCR, and therefore you must have some doctor advising you what to take and what not to take at home also. So it is in your own interest and your own family's interest that you contact your doctor or your local authorities when you turn positive on a self-testing kit. And Dr. Bagai rightly said it, that there should be some system by which it has to be reported once you have bought it from somewhere, and it should not be without prescription, so that then everything is answerable, and it becomes very important. See, the main advantage of the rapid test is the test is within a few minutes, and it is very simple to perform. And if it is positive, it is positive. Um, if you're symptomatic and it is negative, they still advise you do RT-PCR. But otherwise, if it is positive, it is positive. It's immediately you can test it. Otherwise, RT-PCR, even certain private labs are taking 2 to 3 days to report your RT-PCR. By that time, the disease has spread to everybody around you. So I think it is important that this is reported and this is utilized the correct way.
But Dr. Mehta, we're also at a time when the common cold or a flu is very pervasive. Almost everybody you know is either coughing or sneezing and showing symptoms of this. Now, given the fact that we're at a stage where we don't have breathlessness as one of the main symptoms of COVID, it's almost coalesced with the symptoms of a flu. Would it be safer then to just get yourself tested as soon as you show even a regular flu-like symptoms? Because a few weeks ago, the government has said if you have a fever, consider yourself to be COVID positive.
At the moment, as I said earlier, every cough, every cold, every fever has a high degree of suspicion. It is COVID-19 unless it is proven otherwise. So please do not leave it at your own discretion. Contact your doctors. Let him take a decision whether you need to be tested or not. But I think at the moment, it is so rampant that everything is suspicious. Any body ache, fever, headache, cold, cough is COVID-19 unless proven otherwise.
Dr. Bagai, with this new guidelines that the ICMR has issued, they're also streamlining the process and reducing the tests. There is perhaps an argument that at this point we need to test more and not test less. Would you agree with that, or do you think that this is a rule that is perhaps necessary given the nature of Omicron and its pervasiveness?
Like I said, it will be over a period of time when this infection at the rate it is spreading, it is going to be a question of supply and demand. Undoubtedly, even Western countries which have 1/10 the population, 1/5 the population of India are having difficulty in matching the kind of requirement of the number of kits. But the important point which I want to stress on the scientific part of the rapid antigen test is that you have basically 4 gene points which are checked. The RT-PCR focuses on your S part of protein. Now we know that Omicron has what we call as a S gene failure target expression. So it's as a proxy it is picked up to differentiate between Omicron and Delta. Now the rapid antigen test does not focus on the spike part of the protein. It focuses on the N-terminal domain where the main havoc is being created as far as the Omicron is concerned. Therefore, the sensitivity and the specificity, specifically in the Omicron phase, becomes critical. We need to pick them up early. That means your every positive case is not missed. Now, with regards to the number of tests, the more we test, more information we have. But the question is, what kind of capacity do we have as far as data analytics and tracking is concerned? But I think we need to give a very, very strong public message on 3 points. One, do not hide your symptoms. Do not celebrate and do not neglect your first 1 or 2 days of any respiratory symptom, be it a cold, cough, or a mere sore throat, or even a simple body ache. Bring it to the attention of your doctor, even through an online consultation. Point number two, this is the time where we need to stress on masks. And masks are not cotton masks, cloth mask, or a simple surgical mask. We must stress on a high specification N95 mask. And third most important point, which I want to stress, is that you must get yourself double vaccinated. The people in the vulnerable group now, from yesterday onwards, your third dose is available. And last, and the final point I want to make this part of my discussion is that we must avoid crowds. This is the time we have to avoid crowds. This virus spreads quicker than you can say how. There have been animated studies through modeling through AI platforms, which have shown that this actually spreads like smoke in a room. You can't expose yourself and then get tortured, even with asymptomatic or with long COVID symptoms with a mild presentation of COVID. There are case reports which have shown mild or asymptomatic, even Omicron has long-term devastating effects of demyelination and neurological deficits. This is the time to prevent yourself. Mask up, test, isolate, get yourself double vaccinated.
I really hope our politicians, Dr. Bagai, are listening to you about the crowding, because we've seen them show complete disregard for that. We have an example in Karnataka itself as we speak right now of a 11-day Padyatra going on in complete disregard for all those rules. We have a caller this evening, I think, joining us from Chennai, Ramaswamy. Hi, Ramaswamy, please go ahead with your question.
Yeah. Hi, doctor. Good evening.
Yes,
evening.
Mr. Ramaswamy, please go ahead.
Yes. See, I am 70 plus. I've already taken 2 jabs of Moderna. And what do you suggest that I go in for the third dose? Because I'm in India now.
Okay. I'm presuming you took Moderna outside India. Now that they're giving a booster dose within India, you're not sure which one to take, because India says you have to have the same third dose as you did your first 2. Dr. Mehta, let me start off with you, and then we'll allow Dr. Bagai as well.
See, if you took your Moderna more than, say, 9 months, according to the Indian government, then you can take a booster dose. Although the Indian government, the health ministry, will not recognize your first 2 shots because they were not taken here and they were a different make. But then it can be shown as your first shot. So if it was your second Moderna dose was given more than 9 months back, you can take the Covishield or Covaxin, which either of them are available. Whichever is available, please do take it if your shot was more than 9 months back.
Okay, Dr. Bagai, any problem if you mix up the vaccines, because that's what's happening abroad, but not here?
Yeah, so 2 quick points. One is the mix and match, what we call as a combination or a combo vac, what is given, is a well-recognized scientific regime now internationally. People have tried 18 different permutations and combinations between both the mRNA vaccines, which is Pfizer and Moderna, J&J, Novavax, and AstraZeneca, and Sputnik. And they have done it in different combinations. So this has shown anywhere between 25 to 50-fold increase in all kinds of antibodies, including neutralizing antibodies, binding antibodies, anti-spike antibodies, anti-receptor binding antibodies, and your T cells, CD4 and CD8. Now, having given the fact that the gentleman who's on the call has taken 2 Moderna, so let me give you a bit of information that Moderna is supposed to be 2 times more effective than Pfizer. Apple comparison as far as your B cell immunity is concerned. So it's very good you've taken 2 Moderna. They've also got studies done to show 2 Modernas followed by AstraZeneca. Excellent results. But having said that, the Indian government, what it has shown to have the homologous regime of 2 AstraZenecas followed by a third same, or 2 Covishield followed by the third same, is also very good. There is data which has been published as a phase 2 completed trial. It's a wonderful data which has shown the 3 doses, that means the same regime of Covaxin, to be working extremely well with Alpha, Beta, Delta, Delta Plus, and Omicron. anywhere in the range ranging from 32 folds up to 174 folds up of neutralizing antibodies. So the third booster, if it is a combination, it will work very well. You can safely go and take AstraZeneca as a booster. There are clinical trials to actually prove that your third dose after 2 Moderna followed by AstraZeneca will work extremely well for you, both in your B cell arm and your T cell arm.
Okay, Mr. Ramaswamy, I really hope that answered your question. You have two experts really laying it out for you, and you can go ahead and take that booster. Thank you so much for calling in. In fact, we have another caller. We'll just go to them in just a bit. Gentlemen, I just have one question for both of you. Every day we see the COVID numbers, and I'm just digressing a little from the testing routine that we're talking about. Every day we see new COVID numbers come in around this time, and each of those numbers seem higher than the previous day. We tend to calculate that in percentage and say, oh my God, it's 10% higher than the previous day, and so on. And the positivity rate is also going up. At what point do we be worried about the positivity rate? Is there a certain threshold, or does the positivity rate, should it not worry us as it did earlier, given the fact that we are seeing hospitalization less or milder symptoms? Dr. Mehta.
See, positivity rate going up means that percentage of patients people whom we are testing turn out to be positive. That means the disease is spreading. Positivity rate is bound to go up when the numbers are going up. So I think the numbers are peaking and the positivity rate accordingly will go up for some time to come. But I think as the infection will subside, the positivity rate will come down. So at the moment, the mathematical models have shown it to continue till February, March, but I expect in about 6 weeks or so, it should peak and then it should start coming down. I think, as you rightly said, that the severity is less, but that still, if the numbers are very large, we have to be concerned. And as what has been pointed out by Dr. Bagai, I think all those precautions need to be taken. So mask up and take your vaccines and don't go into crowded areas has to be followed strictly, because even if you've taken a booster shot or second shot, it will take about 15 days for your immunity to be kickstarted. So I think stop looking at the numbers. Numbers will go up for a while, but just take care of your own health and your surroundings.
Okay, we have another caller, and Dr. Bagai, I'm just going to come to you with that question just a bit. We have a caller from Delhi, R. Kumar. Good evening. Please go ahead with your question.
Good evening, doctor. My name is R. Kumar from Delhi. I have basically two quick questions. One is that I have completed 39 weeks after COVID Shield. So my name has come for the CoWIN on the CoWIN app. However, I wanted to know, my daughter was declared as COVID positive a few days back, and she's in isolation. So do we go in for the booster, or we get ourselves tested, or what is the way forward for us? Secondly, regarding my daughter, she has now come out of the symptoms, but she is losing after 6 or 7 days her taste and smell.
Okay. Mr. Kumar, are you still with us?
Yes, I am with you.
Yeah, okay.
I'm hearing
let's
you.
Let's over to the doctors and the experts to answer that. Dr. Bagai, do you want to have a go first?
Yeah, so if you have already taken your 2 shots, you're due for your booster from your age category or comorbid category viewpoint, you should go ahead with it. But since your daughter is positive and you have come in close contact with your daughter, it will be wise and prudent to get yourself tested first. In case you have tested first, then your 2 shots earlier, followed by even an asymptomatic or a mild infection, actually acts as your 3rd shot. So you may not then require an actual 3rd injection, so to say. But with regards to your daughter's symptoms, we are so overwhelmed at the present moment with Omicron. Let us not forget that although Omicron doesn't have the classical loss of taste or smell as far as your major symptoms are concerned, we should not forget that Delta is still around, although Omicron is the prominent strain. So it could very well even be a Delta, which your daughter has got. But without the genomic sequence, it will be virtually impossible. So from going forward point of view, I get yourself tested if you've come in close contact with your daughter, which presumably I would say it would have happened in household contact. And if you are positive, then don't go ahead with your third shot.
Okay, Mr. Kumar, I hope that answers your question. Unfortunately, we're running very short of time, but I have one last caller, Ganesh from Gandhinagar. Ganesh, hi, please go ahead. But unfortunately, just that little rider, we're very tight on time.
Okay. Hello.
Yes, please go ahead.
Yes, I had taken the first dose of Sputnik V in August. Can I take the second dose now in January?
Okay, Dr. Mehta?
No, you are not entitled to. See, 9 months should have passed before for your booster. You took the first shot of Sputnik?
First dose. So I'm talking about the second dose.
Yeah, so you can take your second dose after 3 months. So you are entitled to a second dose. You should take it.
Okay, Ganesh, I hope that answers your question. We have to keep it brief. I do apologize for that, though, but maybe we can look at having more questions answered like this. But Dr. Yatin Mehta, Dr. Sanjeev Bagai, thank you so much. I really appreciate you taking time out and sharing your expert analysis here.